Why do some insurance agents push Medicare Advantage plans? Could it be the high commissions? Maybe. If you're new to Medicare and exploring your Medicare plan options, you may talk to an insurance agent who only wants to talk to you about Medicare Advantage plans. You may get the sense that they really want to sell you on it. They often tout the zero plan premium and the perk benefits like a dental benefit or an over-the-counter allowance. They never tell you about the disadvantages of a Medicare Advantage plan, like restrictive networks, prior authorizations, or out-of-pocket costs. They never even mention Medigap, also known as Medicare Supplement. Why? In California, where I'm located, the maximum agent commission when an agent enrolls someone who is new to Medicare on a Medicare Advantage plan is about $780. So if an agent enrolls a couple, they stand to make about $1,560, which isn't a bad day's work and is much higher than the commission if you enrolled someone in a Medigap plan. Is that why some agents push Medicare Advantage? I'm just saying it's possible. Of course, there are times when a Medicare Advantage plan does make sense. The main reason, in my opinion, being affordability. But you should have a clear understanding of both types of plans and the rules and disadvantages of the Medicare Advantage plan, and the potential difficulty of switching back to a Medigap plan later if you're unhappy. If you're new to Medicare and exploring your options, and an agent only wants to sell you on a Medicare Advantage plan, I encourage you to talk to another agent that will give you both sides of the story, Medigap and Medicare Advantage. Which Medicare plan do you want, Medigap or Medicare Advantage, when you are hit with an out-of-the-blue serious health condition? I've helped thousands of people with their Medicare plan selection over the last 30 plus years, and I can't tell you how many times someone is referred to me because they've been diagnosed with a serious health condition, frequently cancer, and they are desperate to get out of their Medicare Advantage plan and be able to see doctors at a world-class cancer treatment center like UC San Francisco, Stanford, UCLA, MD Anderson, Mayo Clinic, Cleveland Clinic, or another center that may have life-saving treatment options for them. Unfortunately, this week alone, I've talked to 2 people referred to me who have been diagnosed with cancer, plus a client who just went on Medicare late last year who was diagnosed with breast cancer. I also had someone who is going on Medicare in June who was referred to me by their financial advisor who is having a simple endoscopy done, and the doctor perforated her esophagus and she ended up getting sepsis and spending 10 days in the hospital. She almost died. The point is that a health crisis can happen to any of us, especially as we get older. Of course, we all hope for the best and try to stay healthy, but any one of us can be hit with an unexpected health problem. And that's when you find out how good your medical insurance is. The last thing you want to be doing when you're dealing with a serious health condition is fighting over treatments or doctors or hospitals you're able to get treatment at with your health plan. That's why I know when I turn 65 in about 18 months, I will be going on a Medicare supplement, also known as a Medigap plan. It's important to know the difference between a Medicare supplement, also known as a Medigap, and a Medicare Advantage plan when you're choosing your Medicare coverage for down the road. If you talk to an agent and they only want to talk to you about Medicare Advantage plans, get a second opinion, because it's very important to know the differences, know the advantages and disadvantages of a Medicare Advantage plan. Reach out to us if we can be of any help.